Over 9 million food stamp recipients are going to lose their benefits, including seniors. This is after the House of Representatives passed a devastating budget that President Trump has supported that calls for deep cuts to SNAP and Medicaid. Let's get right into it. So, here's what's going on. 9 million food stamp recipients are going to lose their benefits because of this budget that is cutting benefits in order to finance President Trump's tax cuts targeted at the rich. And then Congress is also making changes to Medicaid that is going to put a lot of seniors that are currently in nursing homes out of options because millions are going to lose their Medicaid coverage. This is all in the budget that just got passed. I have all the news right now. If you're new to this channel, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update, anything in and out of Congress that's going to affect your food stamps, Medicaid, Social Security, Medicare, and other personal finance issues that seniors care about. Now, before we get started, let me know your city and state. Where are you watching this broadcast from? Go in the comments and give me your city and state because we like to know where our listeners are watching us from. Now, let's talk about the breaking news. Here is the headlines. GOP votes advanced budget that slashed food benefits, Medicaid for millions. And then let's look at the subheadings. Proposed SNAP cuts will potentially take benefits from more than 9 million low-income people in an average month. This is really devastating news. Here's another news station. GOP federal spending bill could cut funding for SNAP and Medicaid, impacting many Tennesseans. House Republicans passed a sweeping spending bill that outlined trillions of dollars in spending cuts expected to impact programs like SNAP and Medicaid. And then here's another headline. House passes budget blueprint that could impact Medicaid and SNAP, deliver tax cuts that favor the rich. The resolution includes massive reduction in federal spending, which experts say is highly unlikely to be achieved without cuts to Medicaid. So, in this budget, there are 5 proposals that President Trump wants to achieve that is going to devastate the food stamps program. Let's talk about it. The first one is the harvest box idea. This is an idea that Trump has been wanting to pass for a very long time. He proposed it during his first term as president, and the Democrats took control of the House and put all the brakes on this idea, but it's back. And essentially, what this is the government taking your food stamps, your EBT card, and instead sending you a box of food, a box of shelf-stable food that you have no choice in picking. Now, this is something that is back in the news and is back in this budget negotiation because it's one of the ways that they want to slash spending and reduce the number of people on food stamps. So when this was pitched before, it was included in the largest singular cut Trump attempted was withhold a portion of benefits and instead provide recipients a box of non-perishable food. Under the plan, the government would theoretically buy the boxes at reduced cost compared with spending recipients their full benefits and pocket the savings. So essentially, they are going to buy you cheap food and then pocket the rest as savings. However, the resources needed to administer a system that delivers millions of food boxes every month will be unprecedented, inefficient, and restrictive compared with the ability of people to buy their own food. And now this is full force because now the Republicans have the House, the Senate, and the presidency. The food box, harvest box idea is back again. Trump's part budget has envisioned much more sweeping cuts. His last one proposed a nearly 30% cut to the program, including new work requirements on top of those already in the program, and a plan to shift a big share of the program to a harvest box, a plan in which households would not get to choose the food they buy, but instead be sent a monthly box of shelf-stable food that the government picks. Now, this ignores people's allergies. This ignores people have health conditions that they cannot eat certain foods. This ignores the fact that people have the freedom to be able to pick the food that they like and don't like. And now they're going to get a box of food that the government sends that is of low quality and is canned and non-perishable food that includes so much additives and preservatives that on one hand they are trying to encourage people to eat healthy, on the other hand they want to take your ABT card and send you this harvest box. And the House of Representatives, the chairman of the Agricultural Committee, is on board, and this is part of the plan to cut $30 billion of food stamps with this idea. Now, when Trump proposed this before, he presented it in a budget in 2021, and on the top item was Harvest Box, saving $123 billion by shifting your SNAP benefits from an EBT card, or at least a majority of your benefits from your EBT card, and in place they send you this harvest box. I want to know what you think, because this is really, really crazy in terms of the scale at which they want to cut food stamps and save the government money, but then they are passing tax cuts that reward the rich and at the back of seniors and low income people who need and have relied on food stamps. About 40% of the benefits issued to household is what they're going to use. About half of these funds to give household eligible for SNAP benefits $90 or more a month a box of non-perishable food such as shelf-stable milk, ready-to-eat cereals, pasta, peanut butter, beans, and canned food. The box will be in lieu of food that this household would otherwise purchase with the part of their SNAP benefits at grocery stores. Participants apparently would have no choice in what food they receive. Let me know your comments. Let me know what you think about this idea. Do you think the harvest box, changing SNAP benefits or a huge part of it into this harvest box idea, is a good idea? Next, they're about to cut benefits for a lot of people and it's going to impact seniors in a very big way. Let's talk about it. This is all over the news, and food pantries are getting ready because of these cuts. This is a January 17 article. Food pantries are bracing for more demand if Trump administration cuts food aid. So let's look at the scale of the cuts. The House Republican budget proposal calls for $230 billion in cuts to SNAP benefits over a decade through the Agricultural Committee. This represents approximately 20% reduction in the program current funding levels and will be the largest cut to food stamps in 30 years. SNAP serves as Americans' most effective tool against hunger, reaching over 42 million Americans, including 1 in 5 children in the United States. The program is particularly crucial for working families, seniors, and disabled individuals who struggle to afford adequate nutrition. The Agricultural Committee has until March 27 to present their detailed plan for implementing these cuts, and they've already voted on it. So this has already been done. Now they're moving to the Senate. These cuts are part of a $2 trillion reduction in mandatory spending proposed by House Republicans. The cuts are being proposed alongside $4.5 trillion in tax cuts that will primarily benefit wealthy Americans, requiring $4 trillion increase in the national debt. Over 42 million Americans receive SNAP benefits, with children making the largest group of recipients. The program serves 11.6% of children and 28% of children between the ages of 5 and 17. And this is going to cut across the country. No matter where you live, blue or red states or purple states, this is going to hit hard. The highest usage rates for SNAP benefits are found in states across different regions: Oregon, New Mexico, Oklahoma, Louisiana, Illinois, West Virginia, and Washington, D.C. This widespread distribution shows how SNAP serves as a crucial safety net across diverse communities, regardless of political affiliation. For example, in Tennessee, 800,000 people rely on SNAP in all 95 counties. And to give you an example of how this is going to devastate specific counties, in Shelby County in Tennessee, 51% of the residents are food insecure and rely heavily on SNAP, and this is going to impact them in devastating ways. Another change they are making is benefit calculation. Republicans plan to restrict future updates to the Thrifty Plan, which is how SNAP benefits are increased. This change could prevent benefits from keeping pace with real cost of food. So as inflation runs rampant, your SNAP benefits are not going to be increased enough to catch up with inflation, which is then going to even restrict how much your benefits can buy you in the future. New proposals seek to expand work requirements to more recipients, including adults up to 65. So seniors up to age 65 would have to work, and parents with school-age children. These requirements will particularly impact older Americans who face discrimination in employment and parents struggling to balance work with childcare. The proposal includes potential conversion to block grants. So basically, block grants work in a way where they're going to look at each population of each state, and then they're going to give you a pot of money for the state to spend on food stamps. And if it runs out, that's it. Versus the current system where whoever is eligible for SNAP can apply, and if you're approved, you get benefits. So there are some states with high population, but they have a low percentage of people who need SNAP. And then there are some states with low population, but they have a higher percentage of people who need SNAP benefits. And currently, the program serves everybody, regardless of where you live. But what they want to do now is base SNAP benefits on the population of each state. And then states like California, New York, Texas, Illinois, with big populations, and Florida will get more. And then if you are in a lower population state, the state is going to get a small amount of money. And when they run out, that's it, regardless of whether the need in that state is greater. They're also going to change eligibility requirements to make it harder for states to grant SNAP benefits. That is how they're going to shave 9 million people or drop 9 million people off SNAP benefits. Now they have control of the entire Congress. So this is something that is in motion. The House has passed it. The Senate is probably going to pass it soon. And the president has indicated that he's going to sign it. So one of the things that is devastating about these changes is that currently the average food stamp beneficiary receives $6.20 per day. They want to reduce that from $6.20 to $1.50 a day. That is how deep the cut is going to be and how devastating it's going to be for families. So it's going to impact local businesses who depend on SNAP benefits. It's going to impact local economies. It's going to impact state budgets. And for small businesses, 80% of the retailers that get SNAP benefits or take SNAP benefits are small businesses. So they are also going to be impacted because in a lot of areas across the country, especially in rural areas, a lot of small businesses rely on SNAP recipients spending their money in their small retail stores, and this is going to have a huge impact. So what can you do? Well, you can call your representative, especially your senators, before they vote on this bill and let them know that you don't want this to happen. The House has already passed the bill, so that ship has sailed already. But the Senate is up next, and things can be stopped there if enough people make noise. So this is an opportunity to call your senator because this is going to happen if people don't rise up and try to stop this. The third change they want to make is ban junk food in SNAP benefits. This is something that the governor of Arkansas has been pushing for. And now with RFK Jr. as the HHS secretary, this is something that's going to happen. And the argument is that a lot of SNAP recipients are using their benefits to buy junk food. 23% or $25 billion a year is spent on what they call junk food. But here is where this gets very confusing. On one hand, they are cutting food stamp benefits, and then on the other hand, they are telling people not to use SNAP to buy junk food. But the thing is that most people who are buying junk food with SNAP is because what is considered junk food is what is also cheaper. So people have very low SNAP benefits. The average SNAP benefits is about $120 to buy food for the entire month. And so people lean on food that is cheaper, which tend to be the food that is not the healthiest. And so if they want to ban junk food and at the same time are trying to limit how much SNAP benefits you can get, it's hard to see how this is going to help the situation. It's probably going to push people to buy more junk food with their SNAP benefits. The fourth change is work requirements. Imposing a harsh work requirement is one of the things that they want to do. The proposal will take SNAP benefits away from adults up to age 65, including many children who are temporarily unemployed, or working fewer than 20 hours a week, despite evidence that such requirements do little or nothing to improve the employment situation. So if you're an adult without dependents, the work requirement is going to get really strict if you're going to continue to receive SNAP benefits. There's only one good news in all of this, which is the summer EBT program, which has become a permanent program that is going to support children who need nutrition during the summer months. So if you know somebody whose child is currently enrolled in the summer or the food lunch program or the breakfast program, this is a program that they're going to benefit from. It's going to help 29 million children across the United States afford food during the summer, and each child is going to get $40 a month for 3 months. So $120 during the summer to be able to support child nutrition. So this is probably the only good news in all of this SNAP bad news. So if you know somebody that has children that are in the school breakfast program, school lunch program, share this video with them, because this is going to be a huge help in providing nutrition, needed nutrition, to 29 million children. So I want to hear from you in the comments. What do you think about these devastating cuts that are coming to food stamps? Is it going to affect you? Do you know somebody that is going to be impacted by this? And if you're a senior on food stamps, how do you think this is going to affect your personal finance? Let me know in the comments. And then let's talk about Medicaid. In addition to food stamps cuts, there's going to be huge cuts to Medicaid. And I think this is even more important for seniors to pay attention to, because 62% of nursing home stays in America is paid for by Medicaid. That is a data point that a lot of seniors don't know about. And so when we talk about Medicaid, seniors don't feel like it affects them immediately. But at some point, if you're a low income senior, you may need Medicaid to pay for your nursing home or long-term care stay. And so let's talk about what's happening here. But before we do that, I want to digress and talk about Medicare. In the comments, a lot of you have been sharing your horror stories around Medicare coverage. Some of you have had coverage dropped, or services that you were relying on dropped from your Medicare plan, or a hospital has shut down or dropped your Medicare plan, and so you can no longer get the services that you need. Well, that is why 90% of all seniors are in the wrong Medicare plan. Well, we've partnered with Chapter Medicare. These guys are the real deal. Chapter is the only Medicare advisor that has access to all 24,000 Medicare plans in the country. Not only that, their agents do not work for commission. And so they are not there to sell you the highest Medicare plan so that they can get commission. They are there mainly to help you find the best plan that suits your needs, your budget, and the critical services that you need. So call the number on the screen, 539-205-2147, or click on the link in the description or the comments, and there's a link to a form that you can fill out right now, and Chapter will reach out to you and help you find the best Medicare plan that fits your need. But there's a small window, so you have to act now and call them before this open enrollment period closes in, where you can make a change to your Medicare plan. Now, let's talk about big cuts to Medicaid. Trump recently said he was not going to touch Medicaid. He said it on video in an interview with Elon Musk, and it's right here on the screen. But then he turns around and then supports the bill that just passed the House that is going to slash Medicaid for millions of people. So let's get into the details. They're going to cut $880 billion in Medicaid and $230 billion in food stamps. So what does this mean for you? What does this mean for seniors that are relying on this particular program? Well, let's get into the details. House Republicans have unveiled a budget proposal directing the Energy and Commerce Committee to find $880 billion in savings over the next decade. This represents one of the largest proposed reduction in Medicaid in the program's history, targeting a program that currently serves 80 million Americans. The cuts are proposed to help finance Trump's tax cut package, estimated to cost between $5 to $11 trillion over 10 years. The administration claims it will only target fraud and waste, but when you look at the details, it looks like they're trying to cut programs that seniors and low-income individuals rely on. Medicaid currently provides health insurance for about 80 million Americans, including children, elderly, disabled, and low-income adults, and it costs $870 billion a year, which is the third biggest spend on the federal budget. So it makes sense to see why they are chomping at the bit to really cut this, because if they are trying to find $2 trillion in savings to finance their tax cuts, you are not going to be able to get $2 trillion without cutting Medicaid, even Medicare, in this particular budget proposal. And then the devastation even extends beyond what the federal government is doing, because now 9 states, including Virginia, have laws that will automatically end Medicare expansion if the federal government funding drops below a certain level. So what that means is that these states, knowing that the federal government can be finicky at times, have put in laws that drop people from Medicaid program in their state if the federal government does not fund the program the way they promised. So in Virginia alone, 630,000 people may lose coverage because of this budget that has been passed by the House, and if it goes through the Senate. Hospitals and health providers, particularly in rural areas, depend heavily on Medicaid payment for survival, so a significant number of them may have to close facilities or reduce access to care in vulnerable communities. Another change they are making, and I'm going to walk you through the 4 big changes that they are making and how much they are trying to save in order to finance this tax cut. The first one is work requirement. Republicans are considering a nationwide work requirement that will save $109 billion, but will cause approximately 1.5 million people to lose Medicaid coverage. The second one is a limit, a cap limit. So a proposal to limit federal funding based on population, similar to what I talked about regarding SNAP benefits, will save $900 billion over 10 years. So basically, regardless of how much need a particular state has, for example, you think about Florida, with all these seniors that are probably needing Medicaid to pay for their nursing home stays, the government is going to send Florida a pot of money and say, hey, you figure out how you're going to spend it. When you run out, you run out. That is different from what is happening now, where if you're a senior and you're low income and you cannot afford nursing home stay, Medicare will provide coverage for you. But they're going to change that system to save $900 billion to finance the tax cuts. Another change they're going to make is a proposal that includes reducing the federal government's contribution to state Medicaid programs. That will save another $530 billion over 10 years. And then they're going to do supplemental payment restrictions, which will limit states' ability to get supplemental payments from the program, and that will save $175 billion. So if you put all this together, there are certain people that are going to be seriously impacted by this. So let's talk about that. So Medicaid pays for essential services, including nursing home care, home health aides, personal care services, and medical equipment that many seniors rely on daily. For many middle-class families, Medicaid becomes a crucial program when their savings are depleted by long-term care costs that Medicare would not cover. A lot of seniors do not realize that Medicare does not touch long-term care or nursing home care. It is Medicaid, if you're low income, that covers that. So this is why you should care about what's happening. But then it goes further. Dual eligibility. There are 12 million Americans that are dual eligible for Medicaid and Medicare. And why is that important? Well, if you are dual eligible, Medicaid pays for your Medicare premium, your deductible, and services that are not covered by Medicare. So with this devastating cuts, The dual coverage is population are going to lose that ability to have Medicaid pay for their Medicare premiums and deductibles and other services. And so seniors are going to further be impacted by what's happening. But there's more. Long-term care coverage. Medicaid is the primary payer for long-term care in America, with 62% of all nursing home residents, and being the only program that covers extended nursing home stays. Without Medicaid, many middle-class seniors would be unable to afford nursing home care, which usually costs about $90,000 a year. And then there's home and community services. Medicaid provides crucial support that allows seniors to remain in their homes through home health care services. So if you're a senior and you want to age in place and you have a health aide come to you to take care of things that you need taken care of health-wise, if you're low income, Medicaid is what pays that home health aide. With these cuts, these services to help seniors avoid or delay expensive nursing home care will be impacted. And then there's family caregiving support. Medicaid helps support family caregivers through programs that pay family members to provide care through respite care services. This support is vital for millions of families struggling to care for elderly parents while maintaining their own jobs and families. Well, that is going to be impacted severely, or maybe a lot of it will be slashed or pushed back to the states who cannot afford it, and so they'll drop it. And then lastly, healthcare safety net. For seniors who have exhausted their savings for paying for healthcare or who never had significant savings to begin with, Medicaid serves as a crucial safety net, ensuring access to necessary medical care. The program often becomes essential when seniors face unexpected health crises or when chronic conditions require extensive care. So I'm saying all this to say that seniors are going to bear the brunt of these Medicaid cuts, because if you are low income and you don't have the money, if you have chronic conditions, if you require nursing home care, if you require memory care, if you require, home health aides, and you don't have the money or cannot afford it, all the programs that are funded by the federal government through Medicaid to help you are going to be severely impacted by this $880 billion cuts. And then disabled families are going to also be impacted. Children, Medicaid currently covers 1 in 3 children in America. Think about that. For every 3 children you see, 1 in 3 of them are covered by Medicaid, and nearly half of all births in America, which I think a lot of people do not realize. So think about how hospitals are going to be impacted. 1 in 2 births in this country are paid for by Medicaid. So $880 billion in cuts means that it's going to disproportionately affect children's access to healthcare. And then working families. A lot of people think that people who are on Medicaid are freeloading, but here is what is not talked about often. Many Medicaid recipients are employed but work in jobs that don't offer health insurance or pay enough to afford private coverage. So they rely on Medicaid. So these devastating cuts will force these families to choose between healthcare and other basic needs. And then here's another big one: rural communities. Rural hospitals and clinics are particularly dependent on Medicaid funding to stay operational. So if you think of rural hospitals, a lot of them are dealing with low-income families who rely on Medicaid for healthcare. So if you see rural hospitals in terms of how they operate, majority of them are relying on Medicaid to stay afloat, because they deal with a lot of patients that can only afford care if Medicaid is paying. So rural hospitals and clinics are particularly dependent on Medicaid funding to stay operational. Cuts will accelerate rural hospital closures and reduce healthcare access in these areas. So this is so bad that there's even tension in the Republican Party. Steve Bannon, who has been a supporter of the president, has been sounding the alarm that if The Republicans got Medicaid is going to impact a lot of people, including the Republican base. But they're not listening. The House has gone ahead and passed the bill. The Senate is next. And despite all this opposition, this is in motion. And the goal is to save as much money to finance tax cuts, to extend the Trump tax cuts from the first term, which disproportionately benefit the top 1%. And your insurance market is also going to be impacted. Major insurance like Centene and Molina, which specialize in Medicaid managed care, would face significant business disruption. And local businesses, many local small businesses rely on Medicaid to provide health coverage for their workers, are also going to be impacted. So as you can see, I've painted a picture of a broad impact on a lot of sectors of the economy. A lot of people, including children, seniors, people on disability, working families, hospitals, rural health centers, that are all going to be impacted by this. So I want to hear from you. Let me know what you think about this. One, the fact that the Republicans, Trump said he was not going to touch Medicaid, and now they're going to gut it. And then let me know how it's going to impact you. Do you know somebody in your family that is going to be impacted? Do you know a senior that is on Medicaid, in nursing home, or assisted living, or long-term care, memory care programs? Do you know children that rely on Medicaid for healthcare? Do you know somebody that is disabled that need extensive care that Medicaid covers? All these people are going to be impacted by these cuts. I want to hear from you in the comments on what you think. And until I see you in my next live, thank you for watching this. And I am going to stay on top of this news and bring you all the updates as they come in.